It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Well, let's get to our next guest. It's Dr. Paul Chuwn Lim, who's a medical director of rehab services from Swedish Neurological Rehabilitation Medicine. We're talking about rehabilitation from strokes, Shannon, and a lot of times I think we assume the stroke is going to be something that is disability for life, but there are things you can do to rehab from it.
Absolutely. Early intervention and quick intervention following a stroke and getting care if you know you're having a stroke is really important for quality outcomes.
All right, here's Shannon O'Kelly and Dr. Lim.
Dr. Lim, welcome to Health Talk. How are you today?
I'm doing great. Thank you so much for having me here today to talk about stroke rehabilitation.
Absolutely. Tell us about your practice and your interest as a physiatrist, particularly in stroke. Maybe talk about your education and how you became interested in treating people in stroke recovery.
Well, I've had the great honor to study and work throughout my medical career here in the Seattle area after living in the Puget Sound since I was 3 years old. I immigrated here with my family then as refugees from Cambodia during the killing fields era. Hearing about the medical needs from my dad at the refugee camps then probably got me interested in medicine initially, but it wasn't until a required rotation during my last year here at the University of Washington School of Medicine that I became interested in rehab medicine in particular and taking care of those with disability. My journey to Swedish has certainly been a lot of hard work, but this has been my life's passion ever since I wanted to be a doctor in junior high, and later discovering what rehab medicine was all about in medical school. Seeing patients get better, guiding them and their families emotionally, physically, and medically through their recovery is what brings me into work every day and makes my job the most rewarding job that I can think of. I frequently tell my patients and their families that it's an honor and a privilege for me to be a part of guiding them through probably their most difficult journey. What is also great about rehab medicine is that the vast majority of our patients get better, and we get to interact with our patients daily for several weeks at a time while they are here in the hospital, and then continue to follow them after they go home for years afterwards.
Absolutely. Tell our listeners, I couldn't agree with you more. Being a physical therapist, Dr. Lim, that's exactly what I was interested in, is the connection and the relationship and the joy that you see when watching someone that progresses through their rehab and can get back to functional activities and quality of life. And stroke, or CVA, cerebral vascular accidents, are not uncommon in today's world. Maybe let's talk about what is a stroke and maybe some early signs and symptoms, and kind of talk about the physiology of a stroke.
The official American Stroke Association definition of a stroke is a disease that affects the arteries leading to and within the brain. It is the number 5 cause of death and a leading cause of disability in the United States. A stroke occurs when the blood vessels that carries oxygen and nutrients to the brain is either blocked by a clot or bursts or ruptures. It used to be the 3rd leading cause of death just a decade ago, behind only cancer and heart disease. But now has moved down into 5th place with all the new acute stroke interventions. It moved past respiratory illnesses and accidents just within the last 10 years.
And what are the complications?
There are many stroke complications. There's things called spasticity or muscle stiffness and tightness, neuropathic pain or nerve pain, and depression or adjustment to disability. Along with that, there can be shoulder pain on the affected side, emotional lability or crying or laughing when you otherwise wouldn't, swallowing problems initially, post-stroke seizures, changes to someone's thinking and communication, visual field cuts and neglect, intractable vertigo and hiccups for posterior strokes, and incoordination and ataxia, along with balance difficulties, increasing your risk of falls, and certainly impacts on your functional independence. Those suffering from more severe strokes are often dependent on others for their basic activities of daily living, such as dressing, toileting, eating, and communication, while others can live independently and return back to work.
Tell us a little bit more about stroke rehabilitation and your practice and how you intervene with a patient that is experiencing a stroke.
As Swedish Cherry Hill is a tertiary stroke center with a comprehensive stroke certification, we take care of the most complicated stroke patients in the Northwest. More than half the patients we take care of are recovering from a stroke, or roughly 53% of patients on our 30-bed acute rehab unit. A neurophysiatrist is often confused with a neurologist, as we take care of many patients together. We work very closely with our neurology colleagues after someone has developed a stroke. A stroke neurologist will take care of someone initially from the time that they are in the emergency room, often involving a neurosurgeon or interventional radiologist for acute stroke management, including IV TPA or IV clot busting, mechanical thrombectomy using a catheter to remove a clot that is blocking an artery, and for those with the most severe strokes, decompressive brain surgeries.
Back with more with Dr. Lim and Shannon O'Kelly next on Como.
It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
We continue our conversation on stroke rehab with Dr. Paul Lim and Shannon O'Kelly.
Dr. Lim, before our break, you were talking about either a clot or a bleed causing a stroke, and your intervention as a neurophysiatrist. Can you keep talking about that a little bit?
Well, as a neurophysiatrist, I also want the more than 6 million stroke survivors in America to be aware of what a specialty trained neurophysiatrist can do for them. We can address difficulties that they are having from their original stroke in conjunction with their primary care provider and a neurologist. We take care of the more complicated recoveries that oftentimes will need help from an expert who deals with disability on an everyday basis.
May is National Stroke Month. Tell us about some indicators or some things that we should watch for regarding strokes.
There has been many public awareness initiatives that have educated the general public about signs and symptoms of a stroke. The BFAST, or BEFAST slogan has greatly increased people's willingness to call 911 when there's even a small chance of a stroke. B is for balance trouble. E is for eye vision loss. F is for facial droop, A is for arm weakness, S is for slurred speech, and T is for time to call 911.
There it is, folks. BFAST, B-E-F-A-S-T. You have to remember those early symptoms. If you're experiencing those, you call 911. It's important to get intervention quick and early in a stroke, particularly if there's a clot or a bleed. Is that right?
Correct, and that's why it's so important to think about those IV TPA options or the mechanical thrombectomy to remove that clot acutely.
Well, Dr. Lim, with early intervention, what are the recovery rates for stroke patients in today's world, particularly under your care at Swedish or someone like you caring for the post-stroke patient?
Recovery after a stroke is quite variable depending on how severe the original stroke was and in which parts of the brain were affected. Also, the duration of recovery varies considerably as well from one patient to the next, depending on how intense a patient's rehab program is and how much help they have at home. The most recovery was within the first month up to 3 months, then starts to slow down at the 3 to 6 month mark, and in older studies seem to plateau at around 6 months. However, newer studies are now showing that that 6 month plateau is not necessarily the case anymore if continued rehab occurs and that you can see ongoing improvements for years to come.
Any new cutting edge in the treatment of stroke, or let's call it a paradigm shift?
Well, traditional rehab employs very skilled physical, occupational, and speech therapists along with rehab physicians using conventional tools like therapy mats, treadmills, small staircases, parallel bars, obstacle courses, and simulated bathrooms, kitchens, and cars. But nowadays, you want to try to utilize gaming technology, virtual reality, the Wii, the PlayStation, all those type of things that make it a little bit more fun to participate in your rehabilitation. And what we utilize all those devices at Swedish with functional electrical stimulation, virtual reality using a smart glove, and the Wii as well.
And if you want more information, how do you contact you or your group at Swedish?
Well, you can find us easily on the web by searching for Swedish Neuro Rehab or Swedish Acute Rehab Unit. There you'll find a lot of information about inpatient rehab and our outpatient practice.
Dr. Lim, thank you so much for your time and great information.
You've been listening to Dr. Paul Chuwn Lim, Medical Director of Rehab Services at Swedish Neurological Rehab Medicine. You can get more information at swedish.org/neurological rehabilitation. Very interesting topic about stroke, Shannon. We've got a lot more people that are becoming more aware of how to spot a stroke.
Everything's about awareness, Tom, those early signs and symptoms and getting care, early care right away.
All right. Thanks again to Dr. Lim for joining us. Next up, we are going to be talking about preeclampsia, which until recently I hadn't heard of. We'll talk about it next on Como.